All right, folks, what is testicular cancer and how is it any different from prostate cancer? With us this morning for 10 minutes, your health is urologist, Dr. Elan Thompson. Morning, Dr. Thompson. How are you, sir?
Morning. Morning, David. Morning.
Let me start with who is a urologist?
So, a urologist is a surgeon who manages problems that affect the urinary tract and the genitals in men. So, I usually start my interviews with patients by telling them, we're surgeons who manage problems that affect the urinary tract, the genitals in men, the kidneys, the bladder, tubes that drain the kidney into the bladder, which is ureters, prostate, penile problems, and the scrotal problems.
Yep.
So that's what we do.
Okay.
Very extensive. So I guess the name suggests what it is, but for the benefits of people like me, sir, what is testicular cancer?
So essentially the testicles are, oval-shaped organs that lie within the scrotum. They are a pair of oval-shaped organs, like eggs pretty much, that lie in the scrotum. The purpose of the testicle really has two main functions. One is hormonal, to produce the majority of testosterone, and the other is, of course, to produce sperm for fertility function. Now, testicular cancer is one of those rare cancers really in our kind of demographic, Black people. And it can arise from any one of the components of the testicle that make up the testicle.
Yep.
So essentially it's, when you get cancers, it can arise from any type of cell that is within a particular organ. So we know that the cell is a unit for an organ, and the particular type of cells that make up the organ can malfunction, so to speak, and that is how you will really get cancers per se. So all the cells that make up the testicle pretty much can undergo this, kind of haphazard growth, which we call it.
Yep. I got this information from nhs.uk.com, and I'm sure you'll correct me if I'm wrong, but it says here it's one of the less common cancers and tends to mostly affect men between 15 and 49. If that is in fact so, why?
So, really it's not clear why younger men seem to be affected. And as I said before, thankfully, in our population, we don't have a large number of patients having testicular cancer. Mm-hmm. Contrast that with a population like in North America, such as Canada, where I did part of my training. And we used to see patients who come in every week with testicular cancer.
Wow.
So essentially, they would be young men in that age group who would come in complaining of a swelling to their testicles. Because in that population, they are encouraged to examine themselves. Similar to what we encourage for breast cancer in women, is to do self-examinations.
Yeah.
We encourage that in men to do self-examination of the scrotum, to detect these masses that may, be at an early stage when first felt.
Yeah. So in the same way, and I think you just said it, but I just want to reinforce it. When men do the self-check, what should they be looking for? Along with the swelling, what are other things that they should be looking for, Doc?
So that's a very good question, because I've had patients who have come to me saying that they feel swelling, and then it ended up being depicted on the picture there, the epididymis, which is a normal structure on the testicle. So it is pretty much any change, any change in a mass like feel. So usually persons would have been examining themselves over a period of time, and if there's a change in terms of a lump that's detected, then usually they should seek some medical attention.
Yeah.
If they feel that change.
No pain or discomfort?
It doesn't have to be painful, and that's a narrative in Jamaica that we really need to dispel in this health talk. People always say, boy, I've never been to the doctor for a check, I've never had any pain or anything, and this is like an 80-year-old person saying that, and it's not necessarily a good thing, because pain sometimes can be very ominous, meaning it's an advanced stage for some malignancies. So we really don't want to use pain when we're speaking about testicular cancer per se. We really want to encourage persons to examine their scrotum, the testicles, and see if there's any change in any mass-like features on the testicle.
Yeah. You mentioned advanced stage. I suspect that any kind of illness that's caught early, you have a greater chance of getting rid of it, including cancer. But what if this one is not caught early? How safe are you, or is that a death sentence?
Not a death sentence, but certainly testicular cancer is one of the bad ones to have in an advanced stage. And this is why we would encourage persons to do self-examination. As I said before, we're blessed to not have it very common in our population, but there is the few patients that we would really want to have the examining themselves. And it doesn't cost anything to do a self-examination, examine your scrotum, and just see if there's any change in any mass-like or growth felt on the testicle. Now, in its advanced stage, I mean, it's very costly to treat. That's the first thing. And the prognosis is pretty bad.
Yeah.
It's definitely with certain type of cancers, especially.
Yeah. Well, we know the testicles are a very important part of the male reproductive system. Would something like testicular cancer have any effect or impact on the capacity to reproduce?
So certainly, and you've seen that age group that it affects. That's the fertile age group for your reproductive years. And when we have discovered that patients have testicular cancer, what we encourage them to do is to do sperm banking. And that's something that is not very widely known about in Jamaica. We do have the ability to do sperm banking here. So I can remember a gentleman who was about 25 who I had operated on. We had planned to take out his testicle for testicular cancer. And he actually went and did sperm banking, which is pretty much putting your sperm in a bank so that when you are ready to use it, it's available to you. So you can get a reduction in your sperm count, your parameters, when you remove the testicle. But the answer to, I'm sure, a question you're going to ask is, can you still reproduce with one testicle? And that answer is yes. But sometimes it's more difficult. So that's why we encourage patients to do sperm banking so that it's not as difficult and they can use it for assisted reproductive techniques in the future.
Yep. What about treatment, Dr. Elan? Is it the same chemotherapy like any other kind of cancer, or is treatment different in this case?
So even though surgery is the mainstay for early stage testicular cancer, yes, chemotherapy and other further surgical management can be offered in advanced stages prior to chemotherapy or even after chemotherapy. So it depends on the type of cancer that is diagnosed that will determine, when I say type of testicular cancer that is diagnosed, that will determine how persons are treated going forward.
Yeah, you said up about 3 or 4 times already that it's not very prevalent, well, it's not prevalent in Jamaica. Having said that, what kind of numbers we're talking about? Just in your practice, I mean, say the last year, how many folks would have turned up with anything like that?
I would say in my practice maybe 2 or 3.
Okay.
Incidentally, before this interview, I had 2 patients last week, over the last 2 weeks, who presented with testicular masses. I mean, they're unlikely to be testicular cancer, but it's just interesting that, we had these patients coming in at this time. So they can be sporadic, and because as urologists, you are a funnel kind of referral center, of course, you'll be getting these patients funneled to you. So it's a little bit more difficult to say, what is the real prevalence or the incidence just based on my practice. Without, at figures, in the population, we have a better idea. But I think it's generally low. That's the idea. It's low, but it can be very significant.
Can we end the interview with you reminding everyone what to do and how to do it testicular cancer?
So essentially, yes, it's rare, but you don't want to be that one person who is affected by testicular cancer. So the advice would be to examine the scrotum, examine the testicles, to see if there are any changes that take place over time with any growth, that may be felt, right? And it is significant if you feel this change, and you should see your doctor for a further examination and probably a scrotal ultrasound. And we shouldn't really be using pain as a feature of any problem for any type of cancers in Jamaica. We really ought to use our screening programs, and with particular reference to testicular cancer, I would say scrotal examination, self-scrotal examination is important.
Yeah. Is it similar to prostate cancer? Doc?
I think he's frozen.
All right, he's frozen. All right.
Oh, he's back.
Doc, is it similar to prostate cancer?
Not at all. So there are
Okay.
two different things.
Okay.
When we talk about prostate cancer, that's a different animal.
Okay.
So one's a lion and one, in terms of how it affects us, and the other one probably is like a kitten
All right.
in terms of how it affects us.
Yeah.
Not in terms of magnitude, certainly, but in terms of how common it is in our
Prevalence.
population.
Yeah, man.
So prostate cancer still remains the lion in Jamaica.
Yeah, man.
Okay.
Thanks for speaking with us, sir. God bless you and your family. Stay safe.
Urologist Dr. Elan Thompson. That's 10 minutes to your health. We'll do it again next Thursday.